Hello everybody, so let's just discuss different kind of bacterial conjunctivitis that we have. Okay, so in the previous video I told you some characteristic features of bacterial conjunctivitis, which were there will be pink eye and there will be mucopurulent discharge. Okay, let's see this picture and define this. So there is conjunctival redness, which is maximum at fornix. Okay, and palpebral conjunctiva. So what is fornix? Fornix is basically the reflection of your palpebral conjunctiva and bulbar conjunctiva. So if this is your eye, okay, and this is your conjunctiva, I'm showing you the lateral view of eye. Okay, if this is your eye, I hope you can understand. If this is your eye, okay, this is your cornea and your iris, etc. So this is your these are your eyelids. Okay, so you know that conjunctiva is of two types, palpebral and bulbar. Palpebral conjunctiva is present inside of your eyelids. Okay, so the conjunctiva that's covering inside of your eyelids is palpebral conjunctiva, and that conjunctiva which is present on your eyeball, okay, on your sclera actually, is your, so conjunctiva is not present on your cornea, remember this. Okay, so the conjunctiva that's present on your sclera is bulbar conjunctiva. So your palpebral conjunctiva, your bulbar conjunctiva, and then there is this folding, okay, this folding by which your palpebral conjunctiva becomes your bulbar conjunctiva. Okay, after this folding, your palpebral conjunctiva becomes bulbar conjunctiva. So this folding is fornix. Okay, so this is palpebral conjunctiva, then there is folding, fornix, and then there is bulbar conjunctiva. Remember this thing. Okay, so in bacterial conjunctivitis you have conjunctival hyperemia maximum at your fornix and palpebral conjunctiva. Okay, see this. Okay, so there is redness on the bulbar conjunctiva as well, but it is maximum at your palpebral conjunctiva, and if you will see in the fornix, it will be maximum as well. Okay, then there is pink eye, means whole conjunctiva is hyperemic. Whole of the conjunctiva is hyperemic. Okay, then there is mucopurulent discharge, flakes often seen in fornix, but not in this picture, I think. Other than that, flakes are also present in fornix. Okay, now what are your differential diagnoses? Remember, mucopurulent, pink eye. Okay, this is your bacterial conjunctivitis. But to be on a safe side, give the list of 2 to 3 diagnoses. You have mucopurulent discharge, profuse purulent discharge is seen in your gonococcal conjunctivitis. So you can mention that this can be gonococcal conjunctivitis as well. Then this can be chlamydial infection, which causes profuse thick discharge. Okay, the bacterial infection is superimposed on viral infection, obviously. And then you can mention membranous conjunctivitis, but this is not membranous conjunctivitis. This can be, but it's not, because in membranous conjunctivitis you have pseudomembrane formation over here. Okay, what are the signs and symptoms of conjunctivitis, or this kind of conjunctivitis particularly? There will be foreign body sensation, there will be lacrimation, burning, and discharge. What kind of discharge? Mucopurulent discharge, classically. Eyelashes may be matted together in the morning because of that mucopurulent discharge. When the person sleeps, that mucopurulent discharge becomes dried, and because of that, lashes are matted together. Okay, what is treatment options do we have for this? Important, irrigate. You need to clear up all the mucopurulent discharge. Okay, lid hygiene maintenance is very important. Some topical antibiotics, like you should know the names. Okay, chloramphenicol, gentamicin, tobramycin, ciprofloxacin, ufloxacin, and moxifloxacin. These are used in bacterial conjunctivitis. Okay, then antibiotic ointments. These were antibiotic drops, topical antibiotic drops, and these are topical antibiotic ointments that we have, like Polyfix is very important, and tobramycin. Okay, so important thing that you should know, topical antibiotic drops are preferred for morning hours because the patient has to work, obviously. In the morning, the patient has to see in the waking hours, you can say, okay? In the waking hours, the patient is prescribed to use topical antibiotic drops, okay? And in sleeping hours, patients are prescribed the ointments, okay? Because they are thick, and so that's why they're used while sleeping, okay? The causes of bacterial conjunctivitis, very important: Staphylococcus aureus, Streptococcus pneumoniae, Haemophilus influenza, Moraxilla catarrhalis, Proteus, and Klebsiella. So this was your bacterial conjunctivitis, also known as pink eye. Okay, next. Okay, this profuse discharge, this profuse thick purulent discharge is the characteristic feature of your gonococcal conjunctivitis. Okay, remember this thing. So this is very important. This profuse, okay, because in bacterial conjunctivitis you had some of the mucopurulent discharge, but this is actually very thick and it's profuse. So this is characteristic feature of your gonococcal conjunctivitis. So what are the characteristic features that we have? We have conjunctival congestion. Okay, conjunctival congestion means there is hyperemia of conjunctiva. You can see at some places. See, the conjunctiva is red from here and it's red from here as well. Then there is eyelid edema. You can see the eyelid is swollen. Then there is periorbital edema as well. Can you see all of this swelling around the eye? Periorbital means around the eye. So there is periorbital edema, means there is the edema around the eye. Can you see this? Okay. Then there is conjunctival chemosis. Okay. And one more important thing, appreciate, can you see all of those matted eyelashes? I didn't write it over here, but appreciate this as well. Okay, eyelashes are matted together because of this thick, profuse purulent discharge. Okay, and obviously there is thick, profuse, creamy discharge, purulent. Keratopathy often seen because this discharge, first it disrupts your tear film and then it irritates your cornea directly. Okay, you can see that this discharge is present in cornea, so obviously it's going to irritate the cornea and leading to keratopathy. Okay, so what are your differential diagnoses? Remember, if someone has this kind of discharge, this is gonococcal conjunctivitis. Okay, this can be bacterial conjunctivitis as well, and this can be vernal keratoconjunctivitis, in which you have classically ropey discharge, thick ropey discharge. It makes ropes. Okay, so but there will be papillae seen, and there will be chemosis. There will be excessive chemosis actually. Okay, and papillae, and yeah, so the history is actually very important here. If the patient has the variation with season, right, or the conjunctivitis is acquired after exposure to some kind of allergen, some kind, special kind of thing. Okay, so think of your vernal keratoconjunctivitis. It will be the conjunctivitis will be recurrent, associated with season, and there will be thick ropey discharge, and there will be papillae on the palpebral conjunctiva. So if the person has this kind of history, these kind of features, so your diagnosis will be vernal keratoconjunctivitis rather than gonococcal conjunctivitis. Okay, so one more. Okay, chlamydial infection causes purulent discharge. This can be chlamydial infection, but chlamydial infection is very dangerous as it causes fibrosis of your palpebral conjunctiva and your bulbar conjunctiva, and it is the most important cause of blindness. Remember this thing. I'll be telling that to you in some of my next videos. Okay, so what are the signs and symptoms of gonococcal conjunctivitis? There will be extremely profuse, thick, creamy pus, obviously. Then there will be discomfort. Obviously, this thick secretion is going to cause a lot of discomfort to the patient. Then there will be pain if cornea is involved. You know that this can cause significant keratopathy because of the irritation caused by this thick, profuse discharge. So if patient is complaining of pain, so be aware that the cornea can be involved. Okay, what are the treatment options do we have? Some people say that you should hospitalize the patient, then you should take the conjunctival smear and send it for a culture and sensitivity to see if this is actually gonococcal conjunctivitis or not. Irrigation is very important. Remove all of those profuse mucopurulent discharge, and topical antibiotics, systemic antibiotics, and topical atropine is very important. Okay. What are the complications the person can get from this gonococcal conjunctivitis? Corneal ulceration, because there is a significant keratopathy. It's corneal ulceration, iritis, iridocyclitis, very important. Okay, so causes obviously Neisseria gonorrhea, which is the diplococci, gram-negative diplococci. Okay. Next bacterial conjunctivitis that we have is your membranous conjunctivitis. Can you see the membrane formation over here? This is not your palpebral conjunctivitis. If I just zoom it out, this is actually not your palpebral conjunctiva. This is a membrane formed over your palpebral conjunctiva on your eyelids inside. Okay, so this is your can you see conjunctival congestion over here? Conjunctiva is actually red, right? Congestion means redness. Okay, there is significant chemosis over here. Conjunctiva is swollen. Membrane over fornix and palpebral conjunctiva, but not on bulbar conjunctiva. Okay, so there is no membrane formation on the bulbar conjunctiva as seen in this picture. Yes, because you can see this vascular pattern, which is obviously not present on membrane, but it's present on your eye. Okay, so this is membrane, and it seems like that it's not present on the bulbar conjunctiva. It's present only on the palpebral conjunctiva. Then you have okay, one more important thing. There will be serous discharge. Okay, one important thing: diphtheric membrane on removal causes bleeding. So when you try to remove this will cause bleeding. Okay, so what are your differential diagnoses? This is membranous conjunctivitis caused by diphtheria. Okay, this can be wired conjunctivitis. Why? Because there is if the person doesn't have this membrane formation and there is only serous discharge, then you'll be thinking of viral conjunctivitis more than the diphtheric conjunctivitis. Okay, but if the membrane is there, you'll be thinking of diphtheric conjunctivitis, obviously. This can be bacterial conjunctivitis, but because of the pink eye, pink look. Okay, but if membrane is there, the diagnosis is membranous conjunctivitis caused by your Corynebacterium diphtheria. Okay. So signs and symptoms: they will mild to moderate swelling, and they will be serous discharge, and obviously there will be membrane formation. Treatment: irrigation. Okay, in every kind of conjunctivitis, go for irrigation. You need to maintain hygiene, and you need to remove all of those debris. Okay, attempt to peel off the membrane. Some people say this, but this is debated. Then anti-diphtheric serum is very important, and topical antibiotic, systemic antibiotic. This condition is rare nowadays because of the vaccination by pentavalent vaccine, so it is kind of like very rare. But if membranous conjunctivitis occur, just this is because of Corynebacterium. Okay, so these are the three important kinds of conjunctivitis caused by bacteria that you need to know. And if you have any kind of questions, write them down in the comment sections below. I will answer there. And subscribe to the channel because it motivates me to make more of such videos for you guys. So I hope this is clear. Best of luck.